I would like to thank the organizers of this event for the kind invitation to be part of this great project. And our organization, it's a non-government organization, National Association for Harm Reduction of a Risk Factor for Human Health, Densaulyk. In Kazakh language, it's mean health. If you will show the slide, I will tell what it will be better. But if it's a problem, I will continue.
I have the clicker here, so when you want to go to the next slide, just say next slide and I'll move along.
Okay, yeah? I see, just a moment. I switch here.
Just let me know you can see the first slide and then we know we're okay.
Okay, next slide, please.
Yeah.
Great. We started our activities and we acquainted with this concept of harm reduction. It's only in 2016. And from that period of time, we did several activities. Our working group was formed, economical research was done. And 2020, we officially registered in Kazakhstan. Next slide, please. And, okay. We first become why we're interested in carrying out this kind of research. The main reason is that we believe that the concept of harm reduction is an effective mechanism of the reduction of non-communicable diseases, and our health depends health depends on 52% on people, only 8 to 10% on medical professionals. In Kazakhstan, its situation is not good. More than 90% of deaths are caused by non-communicable diseases, and the main causes of that diseases are smoking, alcohol, poor diet, physical inactivity, and drug use. Next slide, please. What do all of these causes have in common? It is addiction, mental and physical addiction. And what we are saying to our opponents, the concept of harm reduction is an internationally recognized approach of correcting the behavior factor in a person's life with the aim to reduce the harm for health from bad habits when it is impossible to give them up because of physical and psychological dependence. We are working in several directions to introduce the concept of harm reduction with government organization, the Ministry of Health, local authorities. We are a member of Eurasian Economic Union Working Group on Technical Regulation for Nicotine Products. Next slide. Okay. And we conduct research in the concept of harm reduction also. We're doing it regularly, but next slide, please, also. Because it's fine. We carry out active institutional development of the association. We participate in various international forums on harm reduction, and we speaking when with our government and Minister of Health, we're saying why we are not government organization participate this many events which happened in the world, but you didn't. And they couldn't answer to us in that direction. We cooperate also with countries in our region where the concept of harm reduction is just being to be introduced, and we have close cooperation and sharing of experience with our neighbors countries, Kyrgyzstan, Tajikistan, Uzbekistan, because it's very important. It's our neighbors, it's former Soviet Union Republic, and many things are similar in politics and knowledges in our regions. Next slide, please. What we are doing, we organize educational seminars for non-governmental organization, college and university students for the young generation, because we understand that's preventing of bad habits. It should start it as soon as early as it's maybe from it's better from childhood. also, we published some literature on harm reduction. We cooperate with mass media, and the problem in our region today is a low awareness of the concept of harm reduction, including tobacco harm reduction. But we also the problem is that the Minister of Health used only World Health Organization documents, which required revision on some issues in the fight against smoking, even though the concept is used quite successfully in other areas, such as reducing harm from opioid addiction, which is supported by World Health Organization. And why is our Minister of Health also using, and we cooperate them in that direction very successfully. And why we bring together all concepts of harm reduction, even in the drugs and alcohol and tobacco, even food we bring together, that is for us, it's more easily to explain the harm reduction from nicotine for using examples in another directions for government. And that we started our program educational doctors in our region, different 10 regions in Kazakhstan. We signed agreement with our Ministry of Health that we train it in for harm reduction and professionals, medical professionals in all regions in Kazakhstan. In this year we already trained more than 500 doctors and medical staff in Kazakhstan, and that directions we are moving forward to explain people harm reduction in professional area and in young generation as students of university and colleges. And we are looking also started our activities in school. Thank you very much. And also I wish you good health and Densaulyk ULL. Thank you.